Welcome to a special edition of Modern Wall Street from the New York Stock Exchange. Today, Senate Republican leaders unveiled their healthcare reform bill. Now, there has been plenty of controversy over the drafting of this bill. And of course, healthcare means different things to investors, consumers, as well as Wall Street. So joining me today to weigh in on healthcare is Vince Parry, and he is a veteran of the healthcare communications industry. Vince, great to have you here today.
Well, good morning, Remy, and thanks so much for having me. I really appreciate it.
Well, Vince, we know that branding itself gets a bad rap. So when it comes to healthcare branding, there's a lot of tricky space here. I know that you've been behind the launch of some very famous products, such as Lipitor, Botox, and some pharma names. So can you tell me about healthcare branding?
Yes, healthcare branding is a unique subspecialty of branding. It differs from consumer goods branding in that people want to buy consumer goods. They don't want to buy healthcare brands, they have to. So as a result, there's a built-in resentment about having to do that. So healthcare branding has further to go to convince people of why they should engage with certain brands.
And in the coming weeks, as well as coming months, we know that healthcare will be taking front and center stage for investors as well as for Americans because of what happens down in DC. So going forward, what do you expect to see in the healthcare sector?
Well, it's a classic case of a branding mistake not to sort of include your customers more. Public opinion is really either neutral or positive for Obamacare, and I think this brings up a number of socioeconomic issues that are at the very heart of people's lives. I think it's going to cause a lot of turmoil. The insurance exchanges are certainly at a loss to know what they should do in terms of keeping within the exchanges or dropping out of them. So it's going to cause a tremendous upheaval, and I'm not sure it's that well thought out, and I think the legislators also agree with that.
And Vince, you recently launched a book called Identity Crisis. When it comes to healthcare products that are on the market, it means different things if you're a consumer or a doctor. So as a consumer, how careful should you be when it comes to receiving a prescription for a new product?
Well, I think you really need to be very well informed. I'm one of the few people within my industry that is actually against a lot of TV ads for consumers. I think the products are way too complex and the disease states are way too complex to allow a discussion of that in 30 seconds or less. And I think that people need to be very well informed. The doctors are still the #1 trusted source, and that's the big difference between healthcare branding and consumer goods branding. A customer can't come in and make a direct purchase. They have to go through what I call a learned intermediary, someone who's really looking out for their best interests, and that would be physicians.
And in your book, you mentioned the 3-part Goldilocks branding process. Now, can you tell me why the strategy works when it comes to your sector?
Yes. Throughout my 30-year career, I basically have seen many different types of processes, and different advertising agencies and different branding companies who get paid by the hour have these incredibly complex branding processes that are 4 or 5 or 6 steps. And I've distilled it down to 3 basic steps, which I call the Goldilocks process because it's just right. It's not too long, not too short. That involves discovery, which is really learning about your customers' lives and how your brands can help customers with their lives or restore aspects of their lives that are lost to illness. The strategy section, where you take those values that consumers really value about themselves and impose upon those values onto your brand so that customers see a flattering reflection of yourself. And then in designing packaging and logos and things like that that really represent a visual identification, a flag, if you will, that when people see it, they associate those values with your brand.
And Vince, last but not least, before I let you go, today we're seeing healthcare stocks gain, and this does come on the heels of some of the developments that are happening in DC. But what sectors, what particular parts of that sector do you see as promising in the near term?
Well, I think, and it's probably been said before, but I think people, both manufacturers and investors, would be remiss if they didn't focus on the millennial sector. Millennials are very, very different than baby boomers. Baby boomers have seen health as an absence of illness, whereas millennials see health as an aspirational pursuit, an investment in their own identity. They're very well informed, they're very well empowered, and they're extremely demanding about the kinds of products and services that they get targeted with. So I think from now on, that's going to be the main focus of health and wellness efforts in the manufacturing and service sectors.
Well, Vince, thank you so much for your insight today, and thanks for shedding light on this very interesting topic today.